right, all right. So I'm just waiting for a minute for this to click on and go live. Well, not so much go live, but so that everyone can come on in and see this. If those that want to listen to it and hear what I have to say in the name of the Lord. One of the things that I wanted to talk about today is that when you look at black men specifically, the reason why I chose black men, not simply because I'm a black man, but also because black men are dying more than any other race or any other gender, even including black women. Black men are dying more than anyone else. And so, and if you happen to survive and live, they don't have the quality of life that they should have. And a lot of this comes from, we understand that when I get into this, we understand that a lot of this comes from poverty, but it also comes from ignorance too, right? It also comes from culture, right? Of the things that were passed down to us in our diets and how we eat. But one thing I was taking another look at, I always look at this every now and then, and I was taking a look at deaths, of black men and what is the leading causes of these deaths. And, from the age of 1 year old to 44 years old, the leading cause of death is homicide, okay? But from 45 to 60, I believe to 64, it is the leading cause of death is heart disease, right? And then the next one is cancer. But for the age from 1 to 45, it's homicide, then unintentional deaths, like an accident in a car, motorcycle, or something like that, some type of accident that happens, unintentional. But the leading cause for young black men, the age 1 years old to 44, is homicide. And then the other is heart disease and cancer. So, and as a black man, we're trying to address all of that, right? We're trying to deal with in San Diego, but also in around the nation, right? Of what we should be doing in regards to addressing gun violence prevention, to get young men to put their guns down and pick up a book, pick up something else that's going to be constructive and helpful to your life. And so addressing the homicides is a complex situation because you're dealing with so many different things: arguments, games, drugs, all type of disputes and different things happen, revenge, all type of things happen from homicides when you talk about the violence that take place. But I believe that if our minds are renewed, if we change and get a right kind of mindset, right, we can change. You change your mind, you can change your life when you talk about the homicides. But what I really want to focus on, the part that you can control. If you go out there, you get hit by a car, and somebody's drunk and they run into you, you die unintentionally, you do prayer and God keep you, can something like that happen. Also, a stray bullet, when you're in a violent community, there's some things you can control, right, as far as the violence and not being a part of that violence, but there's sometimes you're not able to. But there are some things that you can control when it comes to dying, young and more than anyone else, and that's dealing with our health. And that's one of the things that I want to talk about, because the leading cause of death for overall black men is heart disease, and then it's cancer, right? So with heart disease, it can easily be preventive, right, if you take care of yourself, exercise, watch the diets, watch what you eat, right? Watch your cholesterol, watch your diabetes, watch your high blood pressure, watch those clogged arteries, because that can lead to a heart attack. And so it's how you eat. Make sure you get your fruits and your vegetables. I see a lot of folks, you posting this horrible food on social media of what you eat. Oh, look at this plate that I'm eating, and I see the plate and I said, man, that's a heart disease ready to happen. And so many people come in and like it, and that's what I talk about, the ignorance, right? We need to get educated on the food that we eat. It's not simply because you're poor and can't afford to buy quality food. It's changing the way you think, right? Because I'm not rich and I watch what I eat, and you can shop smart, right? And buy the right kinds of food. Drink a lot of water. You should at the very least, you should be drinking at least whatever your weight is. You should drink half of that in ounces. So like if you weigh 200 pounds, you should be drinking 100 ounces of water every day. And your body needs that to stay healthy, right? So drink a lot of water, stay hydrated, Eat your fruits and vegetables, at least 7 to 10 servings every day, right? Get your protein. You're going to need carbs, but make sure you get get the complex carbs and not the simple carbs. Simple carbs are like candy and all that kind of sugar stuff. Complex carbs is like fruits, right? That comes in your fruits and things like that. That's good for you because it digests slowly. It doesn't overwork your kidneys and your liver enzymes, all those, your kidneys and things like that, and your insulin. So get your foods right and exercise. That's what I'm here to do. I'm here to go to the gym. I'm here to get my workout on. I'm still losing weight. I'm always on a diet trying to lose weight, right? But I'm always trying to do that because I want to stay healthy, And I started this at a very young age. I have my son, James, that's holding the camera for me on live streaming, and he became a health nut too, and into exercising and diet. He know more of this stuff than I do now, right? About diets and so on. But you got to have that discipline, especially for us, because one of the things when you look at it, we're dying, So, and then the other cause is cancer, right? And when you talk about cancers, there are several cancers that are killing black men. The number one is prostate cancer, right? I just had my prostate checked out, a PSA checked out a couple of weeks now, and it's good. But you got to get that checked all the time, right? Yearly, and sometimes every other year. I think mine said in a couple of years come back. And then the other one, I think prostate is the second leading cause. But guess what? The number one leading cause is lung cancer. And I believe that can be prevented. Stop smoking those cigarettes, stop smoking those blunts, stop smoking all that stuff that ain't no good for you. Because you're going to end up getting lung cancer and it's going to end up killing you, right? If lung cancer don't get you, prostate cancer will get you, and then the other one is colon cancer. And so we got it, and a lot of it comes from eating garbage, right? When you talk about your diets and when you talk about your body and you talk about taking care of yourself, alcohol consumption, drinking, smoking a lot of cigarettes, those are the things that kill us and cause cancer in your body, right? And so you need to eat good foods and superfoods that put antioxidants in your body that can fight off those cells, the oxidative cells that are really that causes cancer in your body. That you want to kill those things, right? You want to have your immune system real strong to be able to fight against those things so that you can stay healthy and live a long time. If other people can do it, it's not a race thing, because black women are living longer than black men. White men and Latinos, they all living longer than black men, but it's how we take care of ourselves. Yes, we're under a lot of stress. Yes, we're dealing with a lot of trauma. Yes, we got a lot of obstacles coming against us. But I'm here to tell you, as a black man, you can still be healthy. I'm 50 years old, 8 years old, and I'm still healthy. But I started at the age of my son, right? I started around 28, 29 years old, start recognizing that we have to take care of ourselves. That's the only reason why today I don't have, and by God's grace, thank God for God, but don't have diabetes, high blood pressure, heart disease, and high cholesterol, and all these different kind of things that a lot of people have, is because I started young, taking care of myself. So even young people, you got to start eating right, or you're going to end up dead by the time you get 55 and your 50s and 60s. Us, people like us, we can live for a long time. You can live into your hundreds. You can live in your 90s now. I mean, the way science is made today, and get those checkups, right? Get your prostate checked out. Get your colon. I lost my sister this year from colon cancer. Get your colon checked out. I had a colonoscopy a couple years ago. He told me come back in 5 years. I'm going back, right? Because we got to use, but in the meantime, eat right. Exercise, get in there and exercise, do resistance training, and also do cardio to keep yourself healthy, right? And I do these things, and I know, it's hard to get the attention of my people, my black people, to really pay attention to me. If somebody come in there with some stupid stuff, you guys will be all on that. But you know what? I'm not going to give up on you, because I love my people. I want to see you healthy. I want to see you live long. So I'm going to keep coming at you until the message resonates. But it's important to get your health right. And so these homicides, we most definitely got to address that, and we are addressing that and dealing with that. But we got to we need the whole community to come together on that to deal with this violence that's taking place in our communities. But we also got to address our health situation. And yes, there are underlying things like poverty, being underserved, what they put in our community, all those kind of things. But in spite of all that, if you educate yourself, and there are ways that you can create for yourself to eat better and be able to afford the foods that you need that are healthy for you, right? It's just how you shop. You've got to shop smarter. And because folks, if you could spend all that money on cigarettes, all that money on liquor, all that money on your dope, and all that money on all wasting money, all these other places. You can invest it in buying having a good diet, and filling your refrigerator with fruits and vegetables, and with proper meats, and cooking it proper. Stop that deep frying food stuff and all these greasy cholesterols and things like that. We got to stop that have all that cholesterol, I should say, that cause the cholesterol and clog your arteries up. We got to stop all that kind of stuff. Let's start eating healthy. Let's get into a place where we take care of ourselves. We want to live longer. We're dying too soon, black men and black women, but black men, we're dying too soon. Get yourself checked out. Get to the doctor, get those physicals, look at your numbers and see what you need to work on. Start losing that weight, get rid of that pop belly. You know what I mean? That big old, we call it a beer belly or whatever. No, man, that's a fat belly. That's unhealthy. That visceral fat, that's unhealthy for you, because it creates cancer and all kind of other stuff. So we got to start working on those things. And you know, you say tomorrow, you better start today, right? So I just wanted to come at you and talk to you a little bit live on Facebook today. This is Bishop Bowser. I just want to come at you live to get you to start thinking about, right? All right, God bless you, and see you next time around.